Hello, everyone, and welcome back to the Empathic Leader, where we talk all things EQ, empathy, and leadership. I am your host, Dr. Melissa Robinson-Winemiller, and I'm so glad to have you here today. Please remember to like, subscribe, and comment so we can keep this conversation going about all things empathy, EQ, and leadership. I have someone today that I think you're going to love. I got such amazing feedback from Dan Winemiller talking about healthcare in the United States. So I have his Canadian counterpart today. Melanie Boulerice is a registered nurse, serial entrepreneur, and owner of the Nomadic Nurse Network Incorporated. But the thing that has me the most intrigued is how she's spearheading the fight against burnout with people in her field, which is really important in healthcare right now. So I'm so excited to bring her on, and I will let her introduce herself better than I'm doing. Welcome to the show, Melanie.
Hi, Melissa. Thank you so much for having me.
It's my pleasure, and I'm so happy to have you here because burnout is a big topic right now anyway, but especially in healthcare. Because who do we depend on when the people we depend on are burnt out? No, it's you guys have a lot on your shoulders. So I'm really excited to bring this topic. But let's start with, I would like you to tell our audience just a little bit about you and how you've chosen your path. Because I know a little bit about you from a different group that we're in, and who you are and what you do and where you're heading is fascinating. So please fill them in.
So I am a registered nurse that is based out of Montreal, Quebec, Canada. I have been a registered nurse for about 13 years now. I've worked primarily in emergency room trauma. I've also worked in psychiatry and did community-based work as well, so like clinic work. And one of the things that I've noticed throughout my career is the huge gaps that we have in our healthcare system in Quebec, primarily that I've worked in. And as just like in America, every province pretty much has its own ways of operating their system. So as much as we have socialized medicine, there is a difference in regards of how the province of Alberta will operate their system. However, there is some overlapping similarities, but in Quebec, we are a little bit more of a lone wolf, let's put it. We're a little bit more of an isolated province. And as we get into the healthcare system, I've noticed so much on the transition from student to professional, which leads to burnout, the transition from one institution to another that can lead to a burnout. I've also learned the longevity of staying in a department without having proper resources to help with your development in your career, in your maintenance of your quality work-life balance, and the list goes on. And burnout is just a constant battle that we have in our healthcare system amongst healthcare professionals, not to mention amongst society as a whole. And this was such a huge topic for me as I was growing up into the nursing profession. And I became an educator at McGill University as well. I was a clinical instructor where we got to educate. I was educating nursing students on clinical. I have also had a huge experience in working in other clinics, such as pharmacies. We have a lot of many clinics going on there. So I was able to talk to patients on various different scales as well. I've also worked in the line of business where burnout is, of course, super common, as we all know, because we're running on what fuel? Like at one point, what are we running on? Coffee. Oh my gosh! Speaking of which, I need to get my cup of coffee. But I've just been so driven from talking about burnout because I burnt out at such a young age. I burnt out 1 year into my profession and multiple times after that, and I needed to find a solution. So I am here to talk about that today.
I think this is fantastic. I mean, it is such a major thing, but especially in healthcare. Now, you tell me if I'm off, because like you said, Quebec is kind of its own little microcosm, is my understanding. So you stop me if I'm wrong. But here in the US, when COVID hit, I mean, a lot of stuff changed. And especially in healthcare, even though these were the people that were frontline and that, I mean, I remember in the very beginning, because my husband's healthcare, we didn't know how fatal this thing was. We didn't know how contagious it was. We didn't know what it was going to do. And yet the healthcare professionals still went in their PPE and their bunny suits and just ready to do whatever they needed to do. Right. But because there were less people, there was this constant push of do more with less, which, okay, a lot of these hospitals are for profit, at least in this country, and because of that, there is a trade-off there. But after COVID, we have never really been able to get off of this do more with less, do more with less, do more with less. And unfortunately, we're hemorrhaging employees because of it, which leads to a lot of places getting travelers, which is something you're involved with as well. So I wondered what you thought about that or your experience with all of that.
Do more with less is probably the slogan for Quebec healthcare. Big time. Yeah. I've only worked, and this led me to travel nursing a little bit. As much as I did love my institution that I was in. Working in Montreal, I was blessed to be with great teams. I worked in great institutions. However, I was called afterwards to transition to go into Canadian travel nursing, so travel across provinces to do it. But in Quebec, we got quite do more with less is the motto, and it's just running us completely dry. In Quebec, we had a $1.5 billion budget cut in healthcare, and this makes a huge difference for us because we are socialized, correct? So because of that, all of our tax-paying dollars gets cut and redistributed where or repurposed where I'll be quite frank with you, I don't know. And there's pluses, and I'm going to be talking, there's pluses to socialized medicine. I want to make that it clear, like we do have free healthcare, and there's other provinces that are running this a little bit better. But in Quebec, we are struggling to make this work. And we need to do better. And it's leading our professionals and even our patients, and our caregivers that are taking care of the patients, family members. There's just a vicious cycle of continuous burnout, then leading to a huge lack of empathy. Like if there's anything it's a huge, huge thing here. But now that I've been traveling across Canada, I've worked in 3 other provinces, and I can safely say that burnout is something that I see across the board. Respite care, because family members are unable to help their family, help the patient because they are going through their version of burnout. They don't have any resources. It does still exist elsewhere. It probably exists in the US. I'm 99.9% sure it exists in the US. However, the issue still remains, the common denominator still remains that we do more with significantly less. And that is the copy paste mechanism. It's just Quebec has mastered it.
Yes. And I mean, there is a debate about socialized versus commercialized medicine, but that's not what this is about, because I think there's pros and cons on both sides.
Right.
You can do either one well, you can do either one badly.
Absolutely.
And that's kind of where I come down on that, But I find this discussion about travelers particularly interesting. I actually mentioned this in my book briefly, because in my experience, my husband was clinical and now he's administrative, and mine was more on the administrative staff side as well. So it's a little different point of view. I was patient facing, but not in the same way, not like clinical people are. He was, which is why he also chose to become a traveler. Because what was happening is the hospital he was in refused to give basically cost of living pay increases. People just weren't able to survive with the rise of inflation with what they were giving them. So it kind of became, the option was either to travel to try and make a living wage or stay where he was at. So he chose to travel. But the irony is that this hospital he was in kept hiring travelers, which cost quite a bit more, are not always embedded in the community or loyal to the hospital, because it was 3-month contract. And so the hospital, it seemed to me, was shooting itself in the foot. They were spending more money when if they would have invested in their people and taken care of burnout and supported the lives of the staff that it had there, then it wouldn't have had to hire in the travelers at double the rate.
Yes.
So here's where I'm seeing that come down.
Mm-hmm.
When I'm talking about leadership and empathy, I talk about empathy in terms of connection and understanding, because we have this idea in society that's I feel what you feel, and that's part of it. But that's not all of it. That's a really small part of this connection and understanding. So the people in the administrative positions weren't connected to their people. They didn't understand that they couldn't do more with less. There wasn't any less to do more with. That was it. They couldn't support their families. They couldn't take care of just basic financial things. And then they were always shocked when these people would go and become travelers, especially considering the populations that they were dealing with sick people, with sad people, with, long-term illnesses. So that was the part that always confused me, because it was like, if you would display a little bit of empathy and understand your workforce, you would have better profit. You would have better productivity. They would come to you with innovation. So,
yeah. The big thing is that, okay, so in Quebec, our goal in Quebec, the Quebec government is to annihilate agencies or travel nurses, quote unquote. And we're in the process of doing that. And it's just proving, the more that they try, the more that they prove that, well, you're just in our budget cut, it included removing agency nurses, or we call them agency nurses, removing them. And also removing positions that nurses already had. So yeah, that's what exactly. The logic ain't logicking. It's not making any sense.
No.
And we ended up losing clinics. We ended up losing staff. I have some nurses that worked for me at Nomadic Nurse Agency with the other part of my company, where we provide services in pharmacies. A couple of them had actually lost their position that they had working as an nurse educator in certain areas. And it's just the irony of all of this is like, well, where are you repurposing this? Because the staff that we already had that was lacking to begin with, we're cutting the agencies, we're also cutting positions, and now you want us to work with literally barely anything. And our nurses are already burnt out. They're already at their complete wits. We're hemorrhaging staff. We're unable to maintain staff and retain staff as much as we try. And I've worked at Quebec's biggest institution in the province. I was a manager there. And keep in mind that job, I loved that job. I worked at a good institution. It's just, again, when you work for a government that wants to cut more and more in your profession and provide less and less quality of care, because that budget cut was also for reparations of materials, reparations of beds, reparations of machines, and so we're literally running on nothing. Like, I remember we had to get creative to try to make a sling for a patient's arm because we had no more slings left. And this is something that's just one of the multitudes of things that we have going on. And with all of this happening, we have it's just we're first world country, a prestigious country, we should say, in Canada. Like, we're running a healthcare system in one of our provinces that is third world grade. I went to Trinidad and Tobago to visit family, and I could not believe the healthcare that my family receives there. And it's equivalent, or in some areas better than what I was doing in Quebec. It was astonishing. And to me, as much as I love my country that I'm from in Trinidad, but knowing the country that it's in, it doesn't make any logical sense how Quebec and Canada has so much more money, is such a bigger country, has so much more resources, that has such prestige, is providing healthcare resources of that nature. Yeah. And this is the huge, huge issue, what's leading us to a lack of empathy, because our nurses are so burnt out that they're no more empathy, it's apathy. And then we have this conversation of, well, nurses are now the conversation of, oh, our heroes are angels in healthcare, which we've been hearing for years in the pandemic and somewhat beyond, all of a sudden we're not recognized as bitter individuals. Why? Why did the narrative change? And it's because of the lack of empathy from the higher up, lack of empathy, that burnout that leads to our managers, burnout that leads to our staff, and then burnout that leads to our patients. It just becomes a full trickle effect.
Yes, absolutely. And I really appreciate you pointing that out, how it really does trickle down from the top. I mean, we can even go beyond that and say it starts with government and then it trickles down. And it's true, because at the end of the day, your customer or your product, or however you care to think of it, is your patient.
Yes.
And they're the ones, I mean, you think about some of these people in these leadership positions, and is this how they would want their mother, their brother, their spouse to be treated? If the answer is no, and the thing is it's not that anybody wants to be apathetic. It's that there's so much empathy fatigue that you can't get around it. It's not that you don't want to, it's that you can't. And the patients are the ones that ultimately suffer.
Yes. And it's leading us to a lot of nurses like myself have decided to leave the country or the province. In my circumstance, I left the province. I started in New Brunswick, went out to British Columbia, and now I'm currently in Nova Scotia. And listen, at the end, before, in all fairness for me, before I became a nurse, while I was in nursing school, I remember the calling on my heart was like, I need to do travel nursing at one point. I've been seeing it. I've been wanting to try it. And it's something that I've wanted to do for a very long time. So for travel nursing for me, there's a little bit more of a heart-to-heart story about it. It's just something that I really wanted to do for a very long time. And it's just, the timing couldn't have been more perfect given the upside down flipping of our healthcare system in Quebec. And it was just time to, life just put me onto this path. However, when it comes down to travel nursing in other provinces that I've seen, there are issues in other provinces. Nowhere is going to be perfect, I will say that, but I do have to say that Quebec takes the cake, sadly enough. And at one point when I was on social media during the pandemic, I did become a healthcare expert in the pandemic in Quebec when it came down to talking about COVID resources and whatnot. And one of the things that the conversation became less and less scientific, and how can you help your counterparts, or how can you help your family, your friends to not get COVID, and how do you isolate and all of those types of things. It became less and less that conversation down the line, and more political. And when it became more and more political, it became more and more bashing of the healthcare system. And there's a little, and I'm, as much as I did say what I said about our healthcare system and the bettering that it requires, I do believe that there's still redemption in that. I do believe if they see it for what it is now, if they see, listen, your issue is not just your budget that you have and how you're managing your entire healthcare system. The issue is that you're also not looking at the people anymore. And I'm here to talk about that component, because I am been a victim of burnout of the healthcare system. I've been a victim of burnout in other circumstances, but the system is far one of them that has drained me to the ground. And I've seen healthcare professionals do that. I've even seen nurses get strangled on the job. How is this even allowed? How is this even getting that to that magnitude, or getting that close? And we're wondering, we're just going to put them back in a system and not come up with better solutions. And this is not an institution issue. This is a government issue. This stems up higher, because this is not the first time ever. This is not a one institution issue. This is a multitude institution issue. Nurses in Florida. There was a nurse that got brutally attacked. I believe. I think it was Florida, brutally attacked. These things happen everywhere. And we're wondering why our nurses are quote unquote bitter. Why are they, what changed after the pandemic? Because we have been working on nothing.
Yes. I actually appreciate you bringing up the violence against clinical professionals thing, because that's on the rise here too. And that's completely unacceptable, completely. But unfortunately, because the empathy isn't able to come down to the patients, often they are also unable to give empathy back the other way. Because when empathy works well, it goes in two directions. Well, right now it's not going in either one. It's
Yes.
a big roadblock. And I shouldn't say that. I mean, that's a blanket statement. But in my experience, that seems to be more true than not. That's a good way to put it. So I would actually like to turn the conversation a little bit and talk about your self-leadership, because you have taken what was a really hard situation and that left you really burnt out and just, dry, and are turning it into a situation where you're leading yourself and at the same time leading others into maybe thinking about things a different way, or changing the system, or creating a different idea. So I'd love to know more about Nomadic Nurse Network. I'd love to know more about what you're doing to combat burnout, because I know you well enough to know you're not the kind of person that's going to sit on your couch if you can go do something about it.
Yeah.
And I would like to know more.
So Nomadic Nurse Network was created in November 2024, but I had Nomadic Nurse Agency since 2020. And Nomadic Nurse Agency was originally a mobile nursing services. We worked during the pandemic where we provide mobile nursing services at home, COVID tests, blood tests, and whatnot. There's still a component of that still carries, especially with the blood test part. However, Nomadic Nurse Network was truly inspired and created for a community-based service. We are a network. We are not a collaborator. We are not a competitor to anybody. Our goal is to completely create a system where we can have other healthcare businesses work together and have a collaborative and fill the gaps that they require to be a successful business, to also be a fulfilling business so that they can help their patients and do their job and prevent them from having to burn out. And because of the lack of resources that are there, we want to create a network where we can all fill the gaps and not feel like we're playing, what was that, whack-a-mole? There we go. We're not playing whack-a-mole with all the problems that come up in our business, but also a community. We are here to create a community for the healthcare professionals and hopefully relate back to the patients, that burnout is something that happens. Burnout is something that is common, and we're creating a network to help combat that, and a resource center to help combat that. So that way nurses can create, or other healthcare professionals can create their ideal career to prevent burnout. I had to create my ideal career path by doing this travel nursing stuff, but I wanted to do more. And I know it sounds crazy. You want to do a full-time nursing? Eventually, the goal is to create such a movement with healthcare professionals that we can have a community that can rely on one another, and also a huge set of resources to help bring back empathy to our patient, to the bedside, bring back empathy to our patients. Because when I studied nursing, I took a caring course, and we have lost that entire essence of a caring course. In Quebec, we also have an issue where we have a law that in Quebec, we have to speak French to every single patient that comes into the door, whether their mother tongue is English or French, or whether we can speak that language. It has been a law as of June 1st of 2024. And this beats completely creates lack of empathy towards the patient. And it's if we can help the patient more, that is not what we were taught. If we know how to communicate and get a point across to a patient for their health, to provide proper healthcare resources, we do that. So we're also creating a system in Nomadic Nurse Network to help patients navigate a challenging healthcare system as well.
That is a fantastic point too, because again, it's back to the patients, right? And trying to navigate this labyrinth, I know here, and I would assume it's not any different necessarily, there's just so many systems and policies and oversight, and some of it's governmental and some of it's from the institution and some of it is state and some of it is, it becomes just this horrific forest to try and dig through when you're potentially going through some of the worst stuff in your life. My mom passed from cirrhosis of the liver in 2008, but it took about 5 years from her diagnosis until she finally passed. And trying to navigate the system was some of the worst parts of that. And at that point, I didn't have any healthcare background at all. So we were all fumbling around blindly. And there are people that I remember that showed empathy and were able to help us. But there are ones that I remembered who really didn't care. They couldn't care. They were done. So,
they were in survival mode.
Yeah.
Why do you go into a healthcare profession thinking that, like, I heard this conversation the other day where somebody told me where nursing is not a calling, nursing is just a job. And as much as when I heard that originally, I took to that differently, because what I find very important is that, yes, there's a part of this that is a job. We're not going to take away from the technicality. It is a job. We're getting paid to do it, and we should be compensated properly. And that is a whole other conversation that I can get into, because in Quebec, we're one of the lowest paying in North America. However, and that was a whole other battle that we were dealing with in Quebec as well. But besides that, but going beyond that point, is that yes, we're just a job where we should be getting paid for it. However, if this was just a job, then anybody would do it.
Yes.
So if it was just a job, if anybody would do it, but if it was a calling, there would be a specific type of person that would do it. And I believe that everybody who's been a nurse or a healthcare professional for X amount of years, who has done the job, who's knowledgeable in the job, they were called to do it. It is a form of a calling. However, it's very, very, very tricky when you make it your identity. And this is the issue with burnout. This is the issue, is that when you are so fried in your calling that you forgot about who you are. And then that's where the identity and calling issue can kind of overlap a little bit, where there needs to be a little bit of a separation there for the sake of decreasing our fight or flight system a little bit, because of the intensity of the system and the working on less to do more aspect of it. It's the issues of the system, not the issue of the profession. And that's what we have to make very, very clear here, is that yes, it is your calling. It's just the system burnt you out, not the calling. And if it was the calling that burnt you out, you have to re-identify and repurpose yourself as to, where did I put too much and where did I put too little, and why am I overcompensating and draining at the bottom of my cup? And this is the huge issue that we have here, is forgetting the fact that yes, this is a calling. However, there needs to be proper boundaries to protect yourself and to protect your identity in order to can maintain that empathy at the bedside.
Yes. And I think that is a fantastic point. It goes in line with what I say, that having empathy doesn't mean you don't have boundaries. Empathy isn't soft. It's very courageous, because you're walking into these situations and you're going to have to lay down boundaries, and you have to protect yourself. Mm-hmm. You have to. And as far as it being a calling and not just a job, I kind of feel like any job you're taking on where there's going to be a level of risk, mm-hmm. and you're dealing with people, especially mm-hmm. delicate populations, like a teacher, like someone clinical, we could even take this to some people that work in the prison systems. You're dealing with people. This can't be just a job, because if mm-hmm. it is, you shouldn't be working with people in that kind of an aspect.
In their vulnerability, in their heavy vulnerability. Yes. You're seeing patients, and again, I'm talking about this on anybody who works in a hospital has a calling. That's my agreement, because you're seeing, like, even the ward clerks that I work with, they have to come in and I have to tell them, listen, and I have to tell them the doctor wants this blood test, this, all of that stuff. If the doctor's not there, they have to physically be around to see to hear what's going on, to be told what to do, so that they can make all the logistics happen for this patient. Right.
Yeah.
And they have to be there to witness the CPR. They have to be there to witness the family members crying on their knees. They have to be there to witness all these things. So every person, and the housekeeper's got to be there to clean up the mess afterwards, after they just watch. Like, do you think that it's easy for example, let's say a family member has their loved ones coming into the hospital because the ambulance had to do CPR and bring them in. My cousin had her father pass away, and she had to do CPR on her dad, and she brought him to the hospital. Unfortunately, he didn't make it. And when she came home, do you understand how hard it was for her to pick up the mess that was laid on the floor with all the stuff?
Oh,
And the housekeeper has a bit of that too. There's a vicarious trauma that comes with that as well. There's also the fact that the security guard has to lock down the hospital because there's a perpetrator on the loose coming to finish off the job for the patient that's coming in with the gunshot wound. This is just the never-ending cycle. So anybody that works in a healthcare institution has such a vital importance there, and there is a form of it that is a calling to them, and it's you play such an important role in this. And there's a burnout that can happen in those professionals as well. We're not going to underestimate that. And we need to, and we need their empathy as well, because I need them to be on point when I'm in the middle of doing CPR and I have somebody else taking notes, and I need someone to make sure that this happens. And with all of this being said, why are we not targeting the issue as a whole? Why are we not evaluating why our healthcare professionals are not performing, rather than just, okay, well, you're not performing very well, or you're not, or we're not having, you spoke to that patient incorrectly. You should be suspended. Well, did you not realize that about a month ago, I almost got attacked by patients, or I did get attacked by patients, and I got some time off, but no one really did a follow-up to make sure that I was okay in their workplace. These follow-up ministries, these follow-ups show empathy from the manager's perspective towards the nurse that will then eventually trickle down to the bedside care. We have to evaluate the way we manage our staff. And I was a manager at one point.
Yeah, but you're learning. You're saying we need to do this better. So that's precisely who I want to see in a management position. Not someone who says, we're going to do it this way because this is how we've always done it.
Mm-hmm.
Someone who says, there's something not working with the system and we can innovate and make better. We can do better. We can have better.
Yeah.
So that's exactly who I want. Melanie, I could talk to you like all day long about this. Obviously, we've just lost a half an hour and I have no idea where it went.
Yeah.
But I want my audience to know how to find you. And we'll put this in the show notes as well. But what's the best way for people to contact you?
So you can find me on Instagram, and you can find me on all platforms pretty much. Instagram, Facebook. You can also find me on YouTube. I have a YouTube channel. I also have TikTok, but the Instagram is at Nomadic Nurse Net. I also have my own personal page at Nurse Melanie JB. We also have my website at www.nomadicnursenetwork.com. We have YouTube, where we have Nomadic Nurse Network, where we have all of our podcast episodes. We have we're going to be showing up a little bit more content in regards to my travel nurse journeys and more discussions on burnout there. You can also find me on TikTok for keeping up to date with as much trends as I possibly can, because it's all that fun TikTok stuff is, it's a lot. But I'm on TikTok as well. Where else am I? Everywhere.
But that's fantastic, because people need to know about this. And despite some of what's going on between our countries at this point, this is a problem for both of us. And there's no reason not to connect over this, because things need to change.
Yeah, absolutely.
Period. Yeah. Okay. So last question.
Yeah.
If you can think of a leader in your life, alive or dead, known or unknown, who influenced you in the way you lead, who would it be and why?
Influenced me in the way I lead. I would say who influenced me in the way I lead is Megan Ashley. She is a podcast host, a devout Christian, and she's somebody that I've watched periodically throughout the years on social media, but the way she's leading today is so inspirational to me, and the way she leads in such faith. Her influence is not a place of ego, but of humility. So my desire is to have influence and aspire to have influence the way she does, and how she displays it, and how open and charismatic and faithful she is. So she is definitely a leader in the faith industry that I find that we could all learn from.
See, that's what I like to hear. It ends up being passing along of all of the good traits that we want in our leaders. So that's perfect. Thank you so much. Melanie, this has been a pleasure. And I would really like to catch up with you again so that we can compare notes from both sides of the border.
Yes.
So thank you so much for being on. And please, everybody, remember to like, subscribe, and comment so we can keep this conversation going. And we will see you next week for another episode of The Empathic Leader.